to the Golden platform, your ultimate channel to kickstart your day with positivity, wellness, well-being, health tips, and a lot of inspiration. I am your host, the Golden. I'm here to support you, guide you, lead healthy, happier lifestyle. Please do well to subscribe to our channel. Ring on the notification bell below to stay updated. Join us today is Miss Daniela. Welcome to the Golden platform. We're pleased to have you today again.
Thank you, Ron, and it is also a pleasure to be here.
Thank you. Please, can you introduce yourself for us?
Okay, my name is Daniela Cordelia Kuma. I am a final year Doctor of Pharmacy student, currently doing my internship at the KNUST Hospital.
Wow. And what is the topic for today?
Okay, so the topic for today is very interesting one. Personally, I like it so much, and it is one that is going to benefit everyone that listens to it. The topic is substance abuse and addiction.
Oh, wow. Okay, so let's go straight to the topic then. Can you please explain to us what is substance abuse and how is it different from addiction?
Okay, so I'm going to use hospital terms a bit, but I'll try as much as possible to also make it more relatable as well.
Oh,
So
yeah. If you can, please. So, it's for the ordinary people. So the
I will make
medical
it
terms, they will not understand it.
I'll make it more relatable. So
Okay.
substance abuse is
Mhm.
using something the wrong way or using something more than you are supposed to use. So let's say um there is a particular drug that you are supposed to take and you are supposed to take it for maybe headache, and then you
Mm.
just took it because you are not feeling okay. You just took it. So let's say paracetamol. You are supposed to take paracetamol for fever or any pain that you feel. And then just because you feel any pain at all, you just start taking it more than even you are supposed to use. That's one aspect. And the second aspect has to do with just taking the drug in for the wrong indication. So let's say you are taking paracetamol for maybe stomach ache, something that you can
Mm.
take antacid for. You are taking it, yes. And then the addiction has to do with chronic abuse.
And what is
So if
chronic abuse?
so chronic abuse is maybe if it is just a one time. So one time, let's say today I'm having headache and then I am taking maybe paracetamol and I'm taking it more often. So paracetamol, I'm not supposed to cross up to 8 tablets in a day. And then I take
Mm.
more than the 8 tablets. It can be abuse. But if it continues, that's an addiction. So you would be addicted to drugs that would give you some pleasure or something that you look out for, like alcohol. Some people take alcohol because they want to run away from stress, or they want to run away from anything that is just stressing them. Like they just
Mm-hmm.
take the alcohol to run away from, say, social responsibilities or anything. Some can take alcohol because of PTSD, like post traumatic stress disorder.
Mm-hmm.
So let's say um I have lost my job and I'm just taking alcohol so many times. Like I've just every time that the alcohol, the symptoms of the me being drunk vanishes, then I go
Mm.
and replace it. That's addiction. And then the abuse
Mm.
could be, let's say I've gone for a party with my friends and then I've taken alcohol more than I'm supposed to take. It's a one-time thing.
Mm. It's a
So
one
that's
time. Oh,
the
so if I can get you right, abuse is one time, doing it one time
It's a one-time
excessively.
thing. Yes, please. Yes, please. So
Excessively. Okay.
alcohol,
And
trying to drink alcohol on an occasional time. Oh, it's friends who I've met and I've taken it more than I'm supposed to take is abuse. But taking alcohol every day is an addiction.
it's
Without
an
it, I can't
addiction.
survive. Yes.
Okay. Okay. This one is just by the way. It's just because you said, for example, paracetamol, you're not supposed to take 8 tablets a day. And for me, and you and me know medical terms, 8 tablets depends on the milligram, you
Okay,
know.
so paracetamol
Yeah.
comes in 500 milligram.
In how many?
500 milligram. One tablet is
Okay.
500 milligrams. So you're not
Yeah.
supposed to see 4 grams in a day.
Yeah. So when it's 500 milligram, then you are not supposed, but I have also
Exceed
seen, 1 gram.
Okay.
I have seen 1 gram and I have seen 250
50
milligram.
grams.
Yeah,
Oh, 50
50
milligram.
milligram. Yeah.
Okay.
So
Right.
it all depends on how many milligram or
Milligram you
grams
have.
is it. Yeah. Yeah. Thank you for explaining that to us. So can you define addiction and how it affects the brain and the body when we get addicted to something?
So, like I said, addiction is more or less like you are addicted to something. I've used the term again. So,
Mm.
if let's say, like I will use alcohol, and then I'll also use benzodiazepines, like diazepam. So,
Mm-hmm.
alcohol, because I've probably lost my job, I take alcohol on a daily basis. So when
Mm-hmm.
once I take the alcohol, it puts me in some kind of euphoric. Euphoric is more or less like extreme happiness. Some of the drugs put you in extreme happiness, like cocaine, opioids, those drugs, they put you in extreme happiness. So you just be there, you just be having some nice sensations in your head.
Feelings, yeah.
Yes, that's euphoria. Okay.
Mm-hmm.
So taking those drugs, without them, my body cannot function normally. That's addiction. It means you are
Mm-hmm.
addicted to the thing that if you don't get it, your body starts to respond. That's
Mm.
actually addiction. So your body responds in a lot of ways. Sometimes your body, especially those who abuse alcohol, if they don't get alcohol, especially the chronic users, if they don't get alcohol to some point, you realize they are getting seizures. They'll be there and their body is shaking. Sometimes they cannot even sleep. They can't stay. Some even get depression and anxiety because you have deprived them from the alcohol. So that's how the body responds to addiction.
Oh, okay. So all those funny feelings and the unusual feelings, the body will be, sending out signals, sending out to us. Okay, okay, we're getting it. So why is it important to address substance abuse and addiction in our community nowadays?
This is really important because substance abuse actually break family trust and it raises a lot of unresponsibleness in the irresponsibleness in the society because you realize that there is a father who is supposed to take care of his kids, you realize that he's using the money that he's supposed to use to take care of them to be drinking. He just
Mhm.
uses them to buy all those substances that he's addicted to. So it
Mhm.
breaks broken homes. It's really, really affects children. You realize that some children are school dropout because their fathers who are supposed to take care of them are abusing drugs anyhow. So that's
Mhm.
one of the ways it actually affects the society. It really brings
Oh,
about
okay.
broken homes and it creates irresponsibleness in the society.
Okay. So, some common risk factors for developing substance abuse disorder. What are some of the common um, risk factors?
Okay, so there are a lot of them, but I'll just mention a few. So if you look at your environment
Mm.
actually predisposes people to growing up at a place that people always drink. I stay at, excuse my
Mhm.
words, I stay at maybe a bar. I stay closer to a bar
Mhm.
where I see a lot of young men sitting down there feeling drunk, and I'm a child. As I'm growing up, I'll see that as a correct behavior because everyone is doing it.
Mm.
So where you stay actually predisposes you to it. It's a risk factor. And also peer
Mhm.
pressure. Oh, I've tried this. It gave me very much happiness. So you can also try it. Peer pressure can also
Mm.
disposes people to it,
Especially the youth.
especially the youth. And
The youth,
also
yeah.
homes. Broken homes can also predispose people to it.
Yeah.
My parents are divorced and I don't know how to take it. I'll just
Mhm.
go out there, sit somewhere, and then take a lot of alcohol or something that would sweep me off the reality. So these are some of the
Mm.
few things that actually predisposes people to it.
What about genetics? Is it also?
Genetics also has its way of making people get predisposed to it. So let's say a mother who was drinking more often when she was pregnant. You know, alcohol has a way that it can change the chemistry of the brain. Most of the
Mm.
substances that people abuse, it can change the chemistry of the brain that without it, the brain feels like something is deficit. So
Mm.
genetics can also change the alcohol or any other substance that we abuse can change the genetic makeup of someone, and it can be passed on to the offsprings that are yet to be born. So genetic can also play
Oh.
into it.
Oh, so genetic plays a role
Genetic
also.
really plays a role
Can
in it.
play. Oh, okay. And what are some of the most commonly abused substance? And how does they affect the body? Most commonly
Okay.
abused substance
I
nowadays.
think I mentioned a few earlier. Alcohol is one of the substances that people abuse so much. So
Mm.
I will talk about the drug and I will talk about when it is being withdrawn, the body's way of responding to it. So if you withdraw alcohol, you start
Mm-hmm.
getting tremors. Some people shake, they really shiver. Some get
Yeah.
seizures because they are being deprived of alcohol. If you look
Mm-hmm.
at opioids, like morphine, fentanyl, pethidine, all these drugs, they are actually they are supposed to be pain relievers. They are opioids. So people really abuse them. If you take them, you realize if you overtake them, you can overdose them because you might not know how much you're supposed to take. And then also you can get respiratory depression. Sometimes you can be
Yeah.
having your other muscles, your axillary muscles are also involved in breathing. You come to the hospital and
Mm.
your heart rates are really high. So some of these drugs, these are some of the drugs that are really abused, and then their their side effects
Oh,
when they are
okay.
being withdrawn.
So in this case, what are some of the long term and the short terms, how do you call it, effects of substance abuse, for our health? So when we're talking about
Some
the physical and the mental, this thing.
Okay. So some of the short term could be say loss of job. You can lose your job because you've started taking alcohol and not reporting to work earlier or not even reporting to work at all. You can lose your job.
Mm.
That's maybe
Mhm.
socially. And then when you look
Mhm.
at the body as well, you can, you can be predisposed to a lot of diseases. Like you can even
Mhm.
get hypertension out of substance abuse. These are short
Mhm.
term and long term. It could even be death because
Mm.
you can get
Mm.
respiratory depression in maybe in one of your hangovers or anything. You can get this respiratory
Mm.
depressions, and also you can even get stroke, these cardiovascular diseases, and all those
Yeah.
things. You can even go
Mm.
mad. These are the long
And
term.
yeah, that is the mental health this thing. Yeah.
Mental health will be at
Mm.
stake.
Mm. Okay. And now we get to the treatments, effective treatments. I know sometimes there will be therapies, which is the non-pharmaceutical, and then the medicine aspect. So if you can explain it to
So
us.
one thing that we mostly tell people who abuse substance is that treatment is possible and then stopping or prevention is reliable. So if you are on alcohol, if you are abusing alcohol and you realize you do not want to take them again, we have drugs that we can give to you that will make you get the same feeling as taking the alcohol. Then
Mm.
we will notify your body that now this is the new thing that you'll be taking. So we will
Mhm.
be withdrawing that one to step by step. We will not abruptly
Yeah.
withdraw it. Remember, I made mention earlier that if somebody is being deprived of alcohol, those who are chronic takers of alcohol, if you
Mm.
withdraw it, they can get seizures, and seizures can also give
Yeah.
them neurological damage. So we don't
Mhm.
stop it abruptly. We stop it step by step. So there are lots
Mm.
of treatments, and those who are psychologically dependent on it, we give them what we call the cognitive behavioral therapy. We'll take you through the need to seek for help and all those things, the need
Mhm.
not to take all those kind of drugs and the possible harm that it causes to the body. So these are some of the treatments that we give, the rehabilitation, introducing them to social support, giving them all the support they need when it comes to the treatment at the long term, and then also making sure that their hands don't get hold of all those things because relapse is really, really key. Relapse, if you are not
Oh,
careful, you would
relapse.
just take,
Yeah. Mm.
yes, if you are not careful, you would say, okay, I've stopped, I've been treated. But once you get relapse, you might even go deeper than you were on earlier. Yes, so there are treatments available. Cognitive behavioral therapy is one of the key things that really, really help people who are on all those substance abuse, and it really, really works. So treatment is
Yeah,
possible.
okay. Thank you very much. So as we are wrapping up, what can individuals do to support, or society, community do to support these people? Support their recovery and prompt overall well-being. What
Okay,
can we do?
so one of the things we can do is parental guidance, because you
Mm,
realize that most of these things starts, they don't just start, they get exposed to it. I'm talking about youth. Sometimes some parents
mm,
do not have control over their kids, so they'll just be taking anything that they see. When they come home, their parents are not, cautioning them on some of these things. So parental guidance can be one of the things that society can do to, stop these substance abuse. And also, people abuse prescription medications. So
mm,
if prescription medications can be taken as and when they need to be taken, like opioids, you don't expose people so much to it. If it's your drug, you take it as and when you're supposed to take it. And some, you won't get any leftovers for somebody to go and take it and have a good feeling and would want more. So some of
yeah.
these things are these, and then also bring them closer and advise them on the need to stop it. I think these are some of the
And
ways we can do.
I saw in the news nowadays, it's very common to get a hold of all these drugs out there.
Yes,
You know,
because most of the drugs that are being abused now are over-the-counter drugs. People abuse cough syrups, and you can't question people so much on cough syrups. I'm coughing. I came to your pharmacy. I want a cough syrup. You will sell it to me. So
mhm.
some of these things you can't stop the youth from getting. It's cough syrup. You can't
Yeah.
stop them.
Mhm.
And
So
then
I think
also
all we can do is keep on educating people,
exactly
let them
education,
understand the consequence
consequences.
and what it does to the body and the mental health. So yeah, you wanted to say something, sorry.
Yes, please. The bar. I mean, people just walk there. It's a social space. People can just walk there
Mm,
anytime and then buy alcohol. Alcohol is really, really a major concern, because when alcohol gets hold of your liver and it's
oh.
just playing with it is really bad. And there is a fact: alcohol, upon taking on an empty stomach, get to the brain within 30 minutes. Within 30
Hmm.
minutes, alcohol intake, and there is no food in the stomach, it gets into the brain within 30 minutes. So imagine
Hmm.
somebody just waking up from bed and then decides to go to get alcohol because he wants to be swept from the reality. Imagine what it will be doing to your brain.
Hmm.
So I think
Hmm.
education is really, really a paramount thing that we can really do. Extend them to anywhere we can so that it will raise awareness. Some don't even know the impact of what they are even doing.
Oh,
So if we
oh,
raise awareness, I'm sure we can get some stopping. All right.
oh, thank you. Thank you. And that is what we are doing now. So shout out to us.
Yeah,
Thank
sure.
you. Thank you, Miss Daniela, for joining the Goldenness. Thank you for listening to the Goldenness and supporting the Goldenness family. Together, we can create a world where our health is our priority and wellness shines bright. Until next time, stay healthy and stay golden. Share the video.